All jurors respond in the negative.
And once again, ladies and gentlemen, I appreciate your continued compliance with the court's directives. We are ready to continue. Mr. Razi, you may call your next witness.
Thank you, Judge.
Judge, if I may, Mr. Razi, before you leave, I just wanted to make a note for the record.
Yes.
Yesterday, I asked for an exception to the separation of witnesses for Dr. John Martin. I am withdrawing that request. He is not present, and I just wanted the record to reflect that he was not present for the testimony of Dr. Westcott and will not be present for the testimony of any other expert by the defense.
All right. I'm sorry, I didn't hear what she said at the end and will not.
Will not be for any other expert called by the defense.
Okay. May I, Judge?
Yes.
Call Dr. Polly Westcott, Your Honor.
Witness sworn.
May I?
Yes.
All right. Good morning, Dr. Westcott. Tell the jury your full name, please.
Good morning. My name is Polly Westcott.
Okay. And how old are you?
I'm 49 years old.
And what do you do for a living?
I'm a neuropsychologist.
And where do you work geographically?
I work in Carmel, Indiana.
How long have you been working in that area as a neuropsychologist?
I've been in that area throughout my entire practicing career, so after, I would say, I moved back to Indiana to complete my residency in 2004, and I've been in Indianapolis, in the Indianapolis area, since that time.
Okay. What's your highest level of education?
I have a doctorate degree.
All right. And in what field?
My doctorate degree is in clinical psychology, and I have 2 specialty concentrations. One is in forensic psychology and one is in neuropsychology.
For those of us that aren't familiar with some of these more technical terms, just tell the jury what the specialty in forensic psychology means, and then tell them what the specialty in neuropsychology means.
Sure. Forensic psychology is a specialty field in which we understand aspects of the law. So whenever, if I was forensic psychologist, which I'm partly forensic psychologist and forensic neuropsychologist, if there were mental health issues, if there were cognitive issues, then we help the courts or juries.
So that's forensic psychology?
Right.
So then, what's neuropsychology?
Neuropsychology is the science and study that really bridges the gap between the medicine world and mental health world. What we do is we understand the brain. The brain is our control center, and how it controls different functions or emotions. So we have specialty skills and tools that help us understand behaviors, and they help us understand how those behaviors tie to specific aspects of brain function.
Okay. Thank you for that. So was there a point in time during this case, I guess, if you will, that Mr. Baldwin and I sought you out and, essentially, hired you to help us?
Yes.
Okay. Just tell the jury generally when that was.
That was in May of 2023.
And are you getting paid to come here today?
Yes, I am.
Tell the jury how much you're getting paid an hour.
For forensic work, I charge $450 an hour.
Okay. And have you ever worked with lawyers before?
Indeed, I have, yes.
Okay. And just give the jury some insight into kind of, what your experience is in working with lawyers in courtrooms. Let me just ask that. I guess I didn't. Have you worked on criminal cases in the past?
I have.
Okay. And give the jury some idea of the scope of that.
Criminal cases, it could be a variety of factors that people seek me out. Again, it's usually to do with the brain or mental health type issues, whether somebody has committed a crime and we want to understand whether or not they knew right from wrong at the time of a crime. It might be that they have a mental health issue or background or cognitive limitations where they can't participate in helping with their testimony with their attorneys, or maybe they can't help to understand what's real or not real, so they can't testify in court, or it might be, do we need to understand what's called mitigating circumstances. Somebody's committed a crime but they have a mental health background or they have cognitive limitations, and that might be taken into consideration for sentencing.
Okay. Do you also testify in civil courtrooms?
I do.
Okay. And would it be, still within this field of forensics and forensic psychology and neuropsychology?
Yes.
Okay. Do you work with both sides, or primarily with the defense, or do you? Just give the jury some idea how that works, if you would.
I've been asked to work with both sides, prosecution and defense, in criminal cases.
Okay. And, have you worked recently with the prosecution?
Yes.
Okay. When was that, the last time you worked with the prosecution?
I would say it was probably a couple months ago. I often will have a question of the prosecution contacting me and asking me about different mental health concepts, what constitutes something like schizophrenia versus depression, if I would look at records to be able to determine if someone is faking a mental health issue or a cognitive issue. So I've done, more recently, I would say behind-the-scenes work, helping prosecution kind of guide their direction of what they're doing in their case.
Okay. And how many times do you think you've been in a courtroom and testified? If you just give us some idea.
I don't know if I can split it up for you. I know I've testified, whether it's deposition or testimony, this'll be my 72nd time, and I would say in a courtroom, I would say, oh, I don't know, this is a guess, probably around 25 times, maybe 30 times out of those 72.
Okay. Let's talk a little bit about your professional experience and work experiences. Have you worked with prisoners in the past?
Yes.
Tell the jury what your extent or scope of work is in that field.
So I have a pretty extensive experience with prisoners. It started back, actually, when I was in college. I worked for 3 years at Wabash Valley Hospital, and even though it was an inpatient psychiatric hospital, we actually...
Kind of like in this case?
Yes.
So I also noticed, I think, at some point, I was looking at your CV, that you have worked with police departments consistently throughout your career in crisis intervention. Can you tell the jury a little bit about that?
Well, if you're talking about crisis intervention specifically, in every police department, or I guess it's growing. Since 2015 there's been a push to understand mental health disorders and to be able to inform what's called crisis intervention teams within local police departments on what are different types of mental health disorders. How can they interact with people who are mentally ill or if they have cognitive difficulties? And so I take part, I'd say, at least 6 times a year.
So you're pretty familiar with law enforcement functions and the administration side of it?
Yes.
Okay. May I approach, Judge?
You may.
I'm going to hand you what's been marked as Exhibit FFF. If you would, just take a look at that. Can you just tell the jury what that document is?
This is a copy of my CV.
Basically, it's your resume, right?
It is.
We call them CVs around here, curriculum vitae, but it's your resume.
Yes.
Talks about your education history and your history as professional experiences, things like that, right?
Yes.
Now, I don't want to get into a bunch of details, but have you also published articles and things like that that are also referenced in here?
Yes.
Okay, Judge, I move to admit FFF. Defendant's Exhibit FFF offered.
No objection.
All right. Without objection, FFF is admitted. Defendant's Exhibit FFF admitted.
May I publish?
You may.
Thank you. Defendant's Exhibit FFF published.
You may proceed.
Thank you, Judge. All right. So we talked a little bit about some of the specialty work that you do. Just tell the jury what you do on a daily basis. Like when you go to work, what kind of things do you do while you're there?
Every day's a little bit different, but I would SI in general I have what's called a clinical practice, so I do typical things that you would think of that a psychologist does. I have patients in my office that I see for therapy. Neuropsychology is really a niche of assessment, and our expertise is using these tools to understand and say what's going on in terms of a diagnosis, whether that diagnosis means that it's a brain-based disorder or it's a mental health-based disorder. So in my clinical practice, in addition to patients, I also get questions from physicians, sometimes sports coaches, various psychiatrists, other people wanting to know what's going on with this individual, and so I'll see somebody for what's called an assessment or an evaluation, depending on what the referral question is, and then, that helps guide treatment.
Okay. You mentioned psychiatrists. Just again quickly explain to the jury what the difference between a psychologist and a psychiatrist is, and how you work together.
Sure. The psychiatrists just look at education, different program. They actually go through medical school and they have really a specialty area that's specifically looking at medications, and they're traditionally the people who will actually prescribe medications for mental health issues. Neuropsychology is a little bit of a hybrid field, so what we do is we actually go through a psychology program, but we also take classes in medical school and neurology, so that we understand brain anatomy, brain function, and then, after schooling, both psychiatry and neuropsychology, we have what's required as a fellowship. So after we graduate, we have to complete a certain amount of ERs under supervised training doing specific things. In psychiatry, again much more related to medications and prescribing medications. In neuropsychology, it would be treatment or assessment. Again, I keep talking about these tools we use. That's kind of our specialty area, are these objective tools that we use to measure and analyze behavior.
So when we first sought out your help, tell the jury what we asked you to do.
When you first contacted me, you told me a little bit of context of what was.
Did you, ultimately, get a chance to review information about Mr. Allen's circumstances, and, if so, just tell the jury kind of what was available to you?
Yes. I was able to say, we'll start with just paper records. So I was able to evaluate extensive records about his mental health history, so treatment before he was incarcerated. I was able to review treatment records and also documents of people who are watching or observing him while he was incarcerated. That would include also various medical records or medicines that were administered. I also reviewed additional video footage. At the time he was incarcerated, he had extensive video footage for months on end and was provided that video footage to evaluate. And I was also able to evaluate phone calls that he made while he was incarcerated. So I would say that's the extent of just the.
Was there anything different about how much information was available in this case to you, historical information, versus the typical case that you would work in?
If you're talking about a criminal case, I was provided an enormous amount of information that is highly atypical for a case. Part of that is because we typically don't have video footage of individuals while they're incarcerated, and so I was able to review 20 or so hours of video footage of him, so I can see for myself his behaviors while he's incarcerated. Also, that he had people who were observing him and they were taking notes, so people they were called watchers, suicide watchers, for a period of time that were other inmates. Then there were other corrections officers that were observing him and taking notes, and we just typically don't have that kind of information because individuals who are pre-trial detainees don't have that level of scrutiny or supervision, so there was an enormous amount of volume of information while he was in corrections that I typically do not have.
Excuse me, could you turn your table mic on, please?
I don't think it's off.
It's off.
There.
Thank you.
May I continue?
Yes.
Generally, and I don't know if you have any dates memorized, but can you give us the jury some idea of when it was that you last got video from me?
I would say I have everything from when he was incarcerated in Westville, and then he was transferred at the end of the year in 2023, going into 2024, into Wabash Valley Corrections, and I believe I stopped getting information somewhere around March or April of this year.
And at some point, did you get a chance to meet Rick Allen?
I did.
And tell the jury how that happened, when it happened, and kind of in what context or what setting.
So it's pretty typical, when someone's asking me for my evaluation or my opinion, where I'll request to meet with an individual and or their family members. So in August of 2023, went out to Westville and performed an evaluation at Westville. And our evaluations typically the interview process takes about 2 hours, and then we have, again, these tests or tools I keep talking about, that usually takes upwards of 5 or 6 hours to complete.
And is this a one-day situation, or do you do it over a couple of days? How does that work?
It's typical we could do it over 1 or 2 days, but in this case actually I think we spread it over 2 days.
Okay, and did you have somebody else assist you generally, like with some of the background work, I guess, if you will?
I did. It's pretty common for neuropsychologists to have what's called a psychometrician, fancy term for someone who understands mental health background. They perform tests. We do it that way on purpose so that they are.
So you actually physically went to Westville and went inside the prison?
I did.
Did your evaluation occur? I can't recall. Was it in the WCU segregated unit, or was out somewhere else in the prison?
It was in the segregated unit.
Okay. And after reviewing all this information and going to Westville and conducting your objective testing, did you generate a report?
I did. I'll add in one more thing that I did. I always request to talk to a family member or loved one, as well, just to give an additional component, a more comprehensive evaluation. In this case, I asked if I could talk with Kathy Allen, Richard Allen's wife, and I met with her several weeks after I met with Mr. Allen, in my office.
So then did you generate a report?
I'll add in one more step. I mean, it's kind of insinuated a little bit, but I know when I had records and I went to Westville, I had asked you for additional records that I wanted. Specifically, I know we didn't have all the medication logs, some of the medical records seemed to be missing, so I had asked you a bunch of questions. Could I have X, Y, and Z? I also had asked specifically about wanting pictures and handwriting samples and other additional things, but yes, after I asked for those things, I received those things. I did eventually write a.
And that report's called an INE, right?
Independent neuropsychological examination, yes.
A really long report, right?
Very long report.
About 120 or 30 pages.
127 pages.
But in fairness, is it accurate to say that a lot of it is, in the middle of it, is just records and stuff that you included that you gathered during the investigation?
Correct. There's a chronological summary of both his records from before incarceration and also, again, there was extensive records of when he was incarcerated, so there's a summary of those records included in the report.
And would it help, if we start talking about some of your findings, would it help for you to refer to your report to refresh your recollection?
Yes, please.
Do you have that with you?
I think I do.
Okay. Well, we're going to talk. If you need to use that, I'll let you get it out. All right. Tell the jury what you learned about Rick Allen. Rick Allen's life from a mental health standpoint. That's the context of all these questions. What you learned about Rick Allen's life before he went to prison.
So a lot of information I'm going to try to condense. I learned that he's had an extensive mental health history. We'll start there. So from the time that he was a child, just based on my interview with him, again talking with Kathy Allen.
What was one of the most significant of those that you observed historically before he got put?
So most of his anxieties in adulthood revolve around two concepts. One is primary work, finding that he feels like he's failing at work, that he's letting other people down at work, that he's not doing his job appropriately. Now, when you look again, that's his own internal experience and belief. When you look at his work history, he's had essentially 3 fairly long jobs, 9 or 10 years apiece, where he's loyal, he's responsible, he does the job, people like him, they promote him. When he's promoted, there's more stress on him, he's expected to actually tell other people what to do, which is something that causes him anxiety. He worries that if he tells somebody what to do, they're not gonna like him, and then he crashes, depression comes over. The companies like him so well that they keep him on and he ends up working for several years. That pattern happens 3 times, where he stays within the job, they're not letting him go, but every time he kind of rises to the top and he's in a management position, he can't handle the stress of it and you see it all over the place where he's at home again kind of crawling, curling up in a ball, crying. His wife plays a key role in kind of putting him back together and making him feel kind of good about himself and kind of sending him back out. And then again, work usually understands and allows him to be demoted and they still keep him on task. But even in lower positions, he's still having that anxiety and depression, because seeing himself kind of fall from that position also contributes to feelings of like.
So there's a bit of a cycle of this in his work history?
Correct.
All right. What about one thing I forgot to ask you about? Does he have any family history of mental illness? And if so, is that important to you? I don't understand the genetic side of all this.
Well, would say.
Judge, may I ask a preliminary question?
You may.
Dr. Westcott, with regard to F.A. Millie history, was the information you received about family history of mental illness all from Mr. Allen?
No. In fact, it was from medical records and Mrs. Allen.
With regard to his own family, though, the medical records are medical records of his where he's previously reported family history, correct?
Correct.
So it's all. The only source is Mr. Allen telling a professional what he believes his family has been diagnosed with?
That's correct.
You didn't have any medical records of those family members to verify those statements, is that correct?
That's correct.
I'd object to the question.
Judge, I think it goes to the weight of, of.
It's also
Certainly, there's a therapeutic.
hearsay from the defendant, Judge.
Sustained.
I'm sorry, I didn't hear what she said.
She said it's also hearsay. Sustained.
Well, she's an expert. She's testifying about the documents she reviewed in preparation for her testimony.
But the objection is the hearsay contained within those records that she didn't review of family members.
Can I continue, Your Honor?
Yes.
Thank you. So was there ever a time in Rick Allen's adult life when he was not suffering from depression and anxiety, based on your review of the records?
I would say there's always a time where he's suffering at some level, right? There's a spectrum for anxiety and depression. There's always some level of anxiety and depression. There are periods of time where symptoms have improved. Usually that's when medications have been switched around or there's been a change in his work environment where there's less of a demand or perceived demand for him. And I would say, too, there was one point in time where, because of his job, he lived away from his family, which was also a point in time where he kind of crumbled and wasn't able to maintain his mental health. But once he reunited with his family again, they were a strong support for him.
Did you also assess him for personality disorders?
Yes.
Okay. What were your findings in that regard?
Found that he has what's called dependent personality disorder. Dependent personality disorder features are someone who really needs other people to be able to feel like they're a whole person, so alone, feels very worthless, doesn't feel like he's capable of doing things, life isn't meaningful, but really relies, in his specific circumstance, on his wife heavily, and I would say to a certain circumstance his mother, as well, to be able to be there and have reinforcement. Say that they love him, tell him that he's a worthwhile person, because he's not able to do that for himself. Also, an abnormal amount of time in dependent personality disordered individuals they spend with their spouse. It's like they can't function alone. They have difficulty making decisions on their own, they have difficulty, just existing on their own. They really need that other person to kind of prop them up and feel a little bit better about their world and their life.
What impact, in your opinion, would his incarceration have, or his dependent personality syndrome have on his incarceration?
It's pretty significant, because take away the incarceration piece, with a primary feature of someone who has dependent personality disorder is they have constant feelings of fear of abandonment and fear of rejection of other people. And again, they don't feel worthwhile on their own. If they're around their loved ones, then they feel a little bit better, but if they're separated from their loved ones, then they really, truly can just fall apart. They really need that as kind of a vein to be able to give them almost like nutrients to be able to sustain how they.
All right. And so ultimately, referring to your independent exam, did you draw some conclusions about those things that I asked you to do a year or more ago?
I did.
Okay. And just to kind of assist here, are those conclusions essentially outlined in the back of your report?
Yes.
Okay. And I'm directing your attention to page 122. If you could turn there, please. Sorry, we don't have a table here.
That's okay.
But I'm noting here that you drew, give me a second here, about 6 different kind of my end conclusions. I'm just counting your paragraphs. Could we start with the first one and just summarize for the jury what your first conclusion was?
My first conclusion is that Mr. Allen had a long history of mental health issues. I'm gonna use the analogy that, essentially, he was a fragile egg. So he was born, you think of an egg, it's got a smooth shell, no cracks. He had, early in childhood, actually, his father abandoned him. Now, his mother.
Judge, I'm gonna object to hearsay.
Judge, may I ask a preliminary question?
Yeah, go ahead.
You said that you researched his history in terms of the documentation from other mental health providers. Is that accurate?
Yes.
And you also spoke with his wife?
Yes.
And you also spoke with him?
Yes.
Are those the types of sources of information that you routinely rely upon when you're generating medical opinions or psychiatric opinions?
Yes.
Judge, I think this is all just in the context and scope of an expert.
Overruled. You laid the foundation.
Thank you for that, Your Honor. Okay, so long history of mental illness. We kind of already touched on that a little bit earlier, right?
Sure.
Okay, and your second conclusion, just generally tell the jury what that was.
So one of the things that we consider in every case, whether it's a criminal evaluation or a civil evaluation, is whether or not someone's lying or there.
What do you do? Like what part of your assessment is important to those, drawing those conclusions one way or another?
It's multifaceted. I would say if we talk hardcore, tell you these tests or tools we use, we actually administer tests or tools that have decades of research that detect whether someone's exaggerating or if they're underreporting and they're not telling us everything. So those tools, whether they're looking at his cognitive functions, we have some there, or the emotional or mental health symptoms, we're looking at those. Those tools will help us know that the information that we're gathering is real information, so it's not an underreport or it's not overreporting or just an out-and-out lie. The other thing is that I'm looking for consistency in behavior, and so there are lots of things that we look towards in terms of an analysis of symptoms that are reported in mental health issues and cognitive issues. What we know is that there are certain things that you look for if someone's faking or exaggerating versus if they have real, for example, psychosis or if they have real cognitive issues, so I'm asking questions about that. I'm looking at observations that I had when I met with him, certainly looking at those things and looking for consistency throughout the videos that I saw, the audio recordings, just looking for consistency. Is this something that's consistent with a true and real experience for mental health, or is it something that wouldn't be what you would typically see in a mental health issue?
So we've heard the phrase objective testing in the courtroom over the last couple weeks. Is that really a big part of this? Not the only part, but a big part of it?
Sure, yes.
Okay, now, let me just see could you explain to the jury, if you did your testing in August of 2023, if you can look back retroactively, tell the jury how that works.
So one of the things we do typically is we look through, again, all the records that we have. We have plenty of records in this case, more so than in any other case I've ever been a part of. So not only do I have extensive records of people who are supervising and watching him constantly, I have videotapes that I watched, audio recordings from every aspect of since he's been incarcerated, and I'm looking for consistency of those symptoms just across time. What would the course be? You know, in my opinion, of course, I'm saying that he had some sort of psychosis. I'm looking for what do I know about psychosis, what does it look like, is it consistent with what I know about psychosis, is it inconsistent? But a lot of that is not only just looking at written records, it's looking at the video and audio recordings to know is that consistent with what I know of as a psychosis.
So did the vast amount of information in this case help you kind of take a retroactive view of his circumstances?
Yes.
All right. And your third conclusion, on page 123, the language here is a little bit deeper. You said, could you just explain that to us in layman's terms?
Essentially, the next point is talking about what were my findings from my.
Are you talking about like his problem-solving abilities, or am I grouping that?
That's next.
Okay.
So this is just the slowing of his thinking.
Got it.
His thinking is slow. Then we look at what's called a portion of the brain that's called the frontal lobe. The frontal lobe is also known as your executive function because it acts as an executive over every aspect of thinking. There's a portion of the frontal lobe that warehouses problem solving, and problem solving meaning that you see a new situation, you try to figure out what's going on, and then you've got to come up with what are the next steps to solve it and move forwards. His problem solving skills are also in that kind of 2 to 4%, it's pretty low. Compared to 2 to 4%, he's performing at the 2 to 4% compared to his peers of same education, same age, and...
Could you give them an example of one of the things that you've observed?
Well, would say two things. One, before he was incarcerated, he would have this constant feeling that he's failing, that he's not living up to his standards as a father or wife, for his wife, a husband, that he's not able to fulfill financially his obligations to his family, when he was actually pretty successful financially, didn't have any debts, there wasn't a reality component. But he could not stop worrying about it, kept checking his bank account, kept checking his stocks. Those kinds of things, couldn't get the thought out of his head. Then, when he's incarcerated, one of the things that there are a variety of things that he becomes fixated on. For a period of time, he becomes fixated on just feeling guilty. He felt guilty before incarceration, has a history in the medical records of he's the type of depressive person who turns situations and makes himself feel bad for whatever's happening around him, and he feels like a bad person. He perseverates on feeling guilty. He feels bad about himself, feels like he's not a worthwhile person, then it leads of course, to a period of time where he fixates on confessing to murders.
So self-blame is a theme for Mr. Allen?
Both before incarceration and after, yes.
Okay. Number 4 on your list here, page 123. What was your finding in that record?
That there's a pretty clear distinction of decline in both physical and mental health when he arrives at Westville, within the first 4 months of his incarceration, and that you see him as someone who, again, is having anxiety and depressive symptoms, then progresses to a little bit more of a suicidal ideation or wanting to hurt himself. Then he kind of pulls back and doesn't talk for a period of time. He's seen mumbling, and then it goes into what we call a psychosis. So he's having hallucinations, he's seeing and hearing things that aren't really there, and then he's having delusions, which means that he's having false beliefs about things that aren't really true. And along with that, it's not just the thinking and what he's saying and reacting to, but he's also having a whole host of other symptoms that are called negative symptoms of psychosis, where he's not showing any kind of emotion. He might stare off and not have any kind of reactivity to things. He's doing things where he's drinking out of a toilet. He's defecating and wiping it on himself and eating the feces. He's banging his head into the wall and hurting himself. He's asking for Trump. He's saluting.
Judge, I would object to her relating any statements by the defendant as hearsay.
They're not offered to prove the truth. They're offered to prove his mental state. So.
Well, and ladies and gentlemen of the jury, it's not substantive evidence, it's not.
May I continue?
For that purpose. Overruled. You may.
Thank you. Okay, so are you. In a state of psychosis. Number 4 on the list is basically that he's decompensated mentally and physically, and that's one of the symptoms or the results of that is the state of psychosis.
Correct.
Is that me being too general or too much of a layperson?
No. That summarizes that point.
Okay, and then, number 5, could you tell the jury what your findings are there?
So that, in number 5, I'm saying that the totality of what I see on the videos, the audio tapes, the records all are consistent with someone who has major depressive disorder, which was well documented in his records. Then, when you have major depressive disorder that hits a severe level, this is what's known just in terms of research. When you hit a severe level and you have a high level of stress, whether it's stress in your environment, stress that you're experiencing internally, that it can actually go into a psychosis, and it's my opinion that he had major depressive disorder with psychosis.
Okay, and number 6, again some words that are a little bit more clinical, etiology. The etiology of Mr. Allen's psychosis is multifactorial. Put that in lay terms for the jury.
Okay. So there's a couple different factors that go into him specifically and understanding this major depressive disorder with psychosis. I mentioned before that I would classify him as kind of like a fragile egg, so he was somebody.
Okay, thank you for that. And so all right. So those are your kind of 6 bullet point findings, if you will. There's some subsections in here, right?
Yes.
All right. And let me ask you this. You had a chance, I think you said earlier, to review some handwriting samples. Is that right?
Yes.
And may I approach, Judge?
You may.
I'm going to hand you what's been marked as GGG. Just take a look at that and tell the jury, I guess, what that is generally.
Judge, may I ask a preliminary question?
You may.
Dr. Westcott, what is your education or experience?
That's part and parcel of what we do as neuropsychology. In fact, we assess what's called dysgraphia, so that's a specific type of handwriting disorder, so we are able to look at different, We look at every aspect of human behavior and we're able to extrapolate information to know, if there's been a change in handwriting, what that might mean in terms of brain function and why it's happening.
And couldn't just regular old intense stress impact handwriting as well?
Yeah, absolutely it could.
Thank you. No other questions.
And so what is that exhibit, GGG?
So this is a letter from Mr. Allen. It says filed November 9th, 2022, where he's essentially asking the court for help in a very detailed way with assistance of having lawyers and whatnot, but it's pretty descriptive and imploring consideration of assistance from the court.
With, I don't know, did I give that to you, or did you get it yourself off?
I think it was one of the things. When I saw his written confession, I had asked, is there any type of handwriting that you have? I think I received this from you, and then I also received a second bit of information from Mrs. Allen where she had given me a letter that he had written to her before incarceration.
Okay.
So I would have a comparison of whether or not his handwriting had changed over time.
I move to admit GGG, Your Honor. Defendant's exhibit GGG offered.
Do you have one for me?
I do. Sorry.
Judge, I would object to the admission of GGG as hearsay.
May I?
Yes.
Judge, it's not being offered for the proof of the truth of the matter. The statement's being offered to show the contrast between his handwriting in this letter and Exhibit 292, which was offered into evidence by the state earlier. It's the letter to the warden, and it's also being offered to show the contrast between the logical thought process that's demonstrated in this exhibit, GGG, and State's 292.
Am I gonna get an opportunity to review the exhibit to rule on her objection?
I'd be happy to give you a copy.
That would help.
It's also in the independent neurological examination that was previously filed with the court many months ago, and there's actually an image of the two letters in that examination, specifically page 116.
Could we have a sidebar?
Sidebar conference conducted.
I mean, there's a lot of hearsay in here that wouldn't be meaningful to the jury. I mean, inaudible, this is really.
I think it's CLASSIC non-hearsay. I mean, I couldn't think of a better example, honestly, because she doesn't care entirely about what he's saying. She cares about the way this looks more than anything.
Well, I understand.
It's classic non-hearsay.
I understand, but there's information in here that has nothing to do with her ability to examine his handwriting. I don't have a problem with some of this going back, but I don't think the letter needs to go back. There's just too much in here.
Like maybe just the first 4 lines and then his signature? She also testified that his handwriting could change just from regular old stress.
Stress.
So how is this?
But that's a weight.
That goes to weight.
Yeah.
That's a weigh issue. Again, I mean, this and the envelope even, for that matter.
Well, I'll just say I'm just trying to be authentic about what I'm offering up. It's the whole document.
Oh no, I understand that.
I don't want to.
I understand that.
I think when you put this up literally side by side with.
The confession itself is about that much information, so.
I mean, this is the concern I have right here, this information. That has no bearing on whether he is guilty or not guilty, and it can be viewed or interpreted by the jury inappropriately. It's begging for sympathy, which I think is inappropriate.
Well, I wasn't.
No, I know that.
I wasn't even representing him at this time. You know what I mean.
I understand that, but I mean.
It's not like it's prepared in an anticipation or anything.
But that is clearly not.
Okay.
I mean, this and the signature and that first 4 lines, and I think that's plenty to give to them.
Maybe what I'll do is, try to do this over the break, and we'll just give it to them later.
Okay.
Just so we're moving along.
I'll show it's admitted over objection.
With their daction.
With their daction.
And you can.
With their dactions.
Can I draw the same lines that you're drawing?
Why don't I just give this back to you?
That would be great.
So this needs to be redacted, so then that gets.
Okay.
This.
That's fine.
And this and maybe the entire envelope, 'cause there's a lot of writing in that as well.
You want me to get rid of it?
Inaudible.
No,
That can come in.
because I agree that can come in.
Perfect.
And that shows some inaudible.
Yeah. I'm going to ask her a couple questions just about the structure, if that's okay. Even T-Hoff, I'm not going to talk about what it says.
Okay.
Does that make sense?
That's fine.
Okay. Very good. Thank you.
Sidebar conference concluded.
All right. Based on our conversation then, I'll show G. is admitted as redacted over the state's objection, and then you can publish your redacted copy later. Defendant's Exhibit GGG admitted.
Very well. Thank you, Judge. I will do that. Ms. Westcott, without talking about some of the words that are in the middle of that document, is the structure of the letter, just the way it looks visually, is that important to you and your analysis?
Yes.
Tell the jury why.
I'm looking at, when someone writes a sample or a letter like this, you can see their thought process, so it's very organized. There are a lot of descriptive words in it, everything spelled correctly, punctuation is appropriate, it's a compelling letter, so you can tell a little bit about intelligence. But really, what I'm looking for is the integrity of sentences and that our thoughts aligned in a way that are organized and make sense. That's a reflection of someone's mental state.
I'll give GGG to the court.
Okay.
Thank you. I'm going to move to publish with their redacted portions. We'll figure that out.
Okay.
Maybe during one of the breaks or overnight, and
That's fine.
offer that later. Thank you for that. Just tell the jury, in summary, what, if any, assistance were the handwriting. I'll use the word exemplars, I guess, or the handwriting samples to you in your analysis.
From looking at, again, the comparison that was from November and then there's a confession statement later where you can see his handwriting again, I'm looking if there are changes that would be a reflection of some cause. Now, consistent with everything else that I'm noticing in terms of symptoms and videos and everything else around the time of when he wrote the confession statement, the handwriting looks very different. It's what we call disorganized in terms of thinking. There are fragments of sentences. The letter structures are not even formulating full letters. There's not grammar and punctuation. His signature looks different. So you can extrapolate what we know. There are studies that look at handwriting and how that changes if someone has a cognitive difficulty or if they're having mental health difficulties like psychosis. That handwriting does indeed change, and the changes are exactly that you don't see full letter construction, you see fragmented thoughts. It's not written linearly, on the lines of paper. It looks very different than the November letter.
Okay, in this letter that you're talking about of November, the letter you were talking about that you're comparing with it, is this it, 292?
Yes.
This is letter that's addressed to the warden, is that right?
That's correct.
Okay, and you would have noted both of these, actually put images of them in your exam?
I did.
Thank you. All right, so I want to talk to you about these objective tests. Let me hand you what's been marked as Exhibit HHH. 2 pages. Just take a quick look at that. Tell me if you've seen them before. Do you recognize that document?
I do.
And, please, tell the jury what that is.
This is a print out of one of the objective personality tests that I administered during my evaluation of Mr. Allen.
And what test is this?
It's called the MCMI. We like our acronyms.
Okay.
But
Tell the jury what this means in short.
essentially, there are 2 different testing instruments that we gave that are what's called comprehensive objective tests. What that means is we're evaluating with these tests. There are hundreds and hundreds of questions that he's filling out, and he's filling out true or false. They're symptom statements. Is it true for you / false for you? They analyze or give us information if there's any presence of a personality disorder. We talked about before with dependent personality disorder. There are personality features that are assessed, so personality features being their lifelong traits we all have, one that I would give.
Do the test results also, or does the test also focus on this issue of malingering or faking or feigning? We've heard a lot of words. I guess I'll use the word faking behavior.
Yeah.
Does it do that?
Yeah. And so on both tests, we're looking at, and there are different ways or questions that they ask that are looking for whether somebody's either exaggerating or faking or also holding information and not giving us information.
Underreporting?
So yes. We have to know, is the information on this an accurate and real picture of what's going on, or are there concerns there?
And are these the results from Mr. Allen's objective testing? Are these the MCMI results that you generated from August of 2023?
Yes.
I move to admit, Your Honor. Defendant's Exhibit HHH offered.
Judge, the state would object. This particular document is only one tool that she used. We asked for copies of all of these.
Judge, first of all, they never even took the time to take a deposition of her in the last year and a half. They had an opportunity to do discovery. I offered up this INE to them and the court. It was filed with the court. I don't want to get into exact dates, but it was months and months ago. This information has been available to them for months, maybe even more than a year. I'm just losing my timing. There is case law that does support that the results of an MMPI, which is kind of the sister test to this MCMI, is admissible. I have that case with me today. You know, it's part of what she relies upon in the course of her findings, so I think it's relevant. It has a tendency to prove that what she's saying today is reliable and accurate and based on sound testing practices, so I think it's admissible for all those reasons.
Judge, after the report was provided and after I reviewed it, I asked for the 12 assessment tests that were administered, along with their results. I was advised they were not available to the state unless they were sent directly to another mental health professional. Our choice not to depose the witness does not reflect on our interest in what she has to say or doing our homework with regard to her testimony. My point is that this is one test out of 12, and that might not be accurate. There may be more, based on the way they're described in the report, and it is inappropriate to take this one test and hand it to the jury when, as an attorney, I was considered unqualified.
Judge, they could have sought the court's intervention to get whatever documents they needed. That also was not done.
Well, in all fairness, discovery is mutual and non-exclusive, so if you had information and you didn't provide it, that seems to be the base of the objection.
Well, her saying that, is that the basis for it not being provided? We gave them the examinations.
All of them.
You gave me.
I gave her the 145-page report.
127-page report, and I asked for the 12 assessment tools, and you said they were not allowed to be given to me.
Okay. Then I'll show that the state is objecting to HHH and will not admit it.
I'm sorry, Judge.
It is not admitted.
Thank you. Do you have the document or the exhibit?
I don't have the exhibit.
I may have just handed it to the court. Did I do that?
Yes.
I just want to make sure we got track of it.
Yes.
Okay, very good.
Yes, Jody's got it.
All right, that's fine. Well, we'll do it this way. So tell the jury what you learned when you conducted the MCMI as it relates to Mr. Allen faking his behavior.
There's no indication that he wasn't telling the truth or being straightforward or honest on that test.
And tell the jury what you learned from the result of the MCMI as it relates to his personality disorder.
So in terms of personality, I'll say disorders are factors. I guess I'm gonna make a distinguishing characteristic because the test, as I mentioned, goes through and talks about just general personality traits. For me, that's important, because you have to understand how someone is in terms of their personality to understand if there's an event or something or stress happens how we can expect that they might either decompensate or it might be a better situation for them. So you're asking about personality factors, what I was talking about before, things that are long-standing. He's somebody who tends to keep more to himself. He's somebody who tends to be extremely dependent on others to be able to feel good about himself. He's more passive. He avoids confrontation. He avoids conflict. He has a strong fear of rejection or abandonment from others. And he also is somebody who, again, in that piece of avoiding conflict or confrontation, he tends to be more quiet and pulls away and kind of steps back from situations. Those would be more of the personality factors, if you're just sticking with that.
Is there? I haven't asked this question I don't think today. Is there a way?
I, frankly, would have to count.
Give us some idea.
I actually think it's more like 25. I think when 12 was mentioned, they're different tests that have different components to it, so it might say one test, but it has different components.
Okay.
It would be a guess, I would say somewhere around 25.
Did you compare and contrast the results of each of the objective tests to make sure that there's some validity in either a part or the whole of those tests?
Yes. I'm looking for consistency always, whether it's the cognitive test or it's the emotional and personality tests, I'm looking for consistency. There are two tests that measure very similar things and I want to see, if I'm looking for, if there's depression, we're seeing depression at about the same level on one test versus the other. The MCMI does a little bit better job of describing these personality factors we just talked about, whether, again, someone's introverted or extroverted, are they aggressive or tend to be more passive, and so that offers a little bit different component than the other one, the MMPI, but with both of them, I'm looking for consistency about validity, whether or not there's a presence of a mental health disorder like depression or bipolar disorder or schizophrenia, those kinds of things.
Did you find consistency amongst those objective tests with regard to his state of psychosis?
Yes.
Okay, just explain to the jury in short, in summary, kind of what you found in that regard.
So he's someone who has, again, I'm going to use a clinical term of little emotional reserves, he's not very resilient. So in the face of stress, given that he has a long history of depression and anxiety, he is much more likely than the typical person, when he hits a stressful situation, to decompensate and then enter into a psychosis.
Okay, and with regard to that psychosis, I know everybody wants dates and times and numbers. Just give the jury an idea in your mind as to when you think he was in that state of psychosis based on your review of the instruments.
Well, I start seeing changes that make me concerned about what we call prodromal or initial symptoms of psychosis even between December of 2022, into March of 2023. Where you start seeing less of an emotional expression, they're called negative symptoms, so less of an emotional reactivity. There's notes and records where there's slowing of thinking. He's keeping more to himself. There are notes of him mumbling to himself. But really, when you're seeing the blatant symptoms of psychosis are really into April, May, and June of 2023. Now, from that point in time, after 2023, there is some improvement in psychotic or psychosis symptoms and you still see some residuals of psychosis going forward, but I wouldn't say it rises to the level of a full psychotic disorder after June/July time period.
So there was some planning out of his circumstances, but there are dips?
Yes.
Okay, so tell the jury, with regard to this objective testing in summary, again, what you found, whether or not your findings regarding his faking.
On any objective test of personality, and I'll also say on any objective test of cognitive thinking, so his thinking skills, consistently across everything, any way that we look at faking, which I would say that, in itself, could be upwards of, there may be 30 different ways that we look of whether someone's faking on these types of objective tests. There's no indication of any type of faking, exaggeration, or underreporting symptoms.
Okay, thank you for that. A couple of, I guess, loose ends, if you will. There's been some talk in the courtroom about SMI, serious mental illness. Do you recognize that phrase?
Yes.
Okay, tell the jury, from a clinical standpoint, what does that phrase mean to you in the course of your work, especially with Mr. Allen, but generally as well?
Judge, I would object to the response unless it pertains to that definition in the DOC pertaining to Mr. Allen, which I don't believe she's qualified to answer because there could be a misapplication or misinterpretation of the definition out in the clinical world where she's functioning.
Judge, she's worked with in the prison system. She's,
Well, let's limit it, then, to the prison system.
Yeah, I appreciate that. I will do that. So are you familiar with that designation?
Yes.
And are you familiar with it in the context of the prison system?
It only exists in the context of a prison system.
Okay.
So yes, my familiarity is when we mentioned before that I've worked in prison systems before, and I also tend to evaluate people in prison systems, so I've seen the definition and understand serious mental illness.
Okay. So in the clinical setting, like in your professional setting, Do you have, I guess, an equivalent to that?
Yes.
Tell the jury what that is and talk.
Objection, Judge. That's not relevant to Mr. Allen.
Well,
Overruled. I think it goes to the weight. I don't think we need to belabor this point, because he's not in a clinical setting. He's in a prison setting, but she can answer the question.
thank you.
So in a clinical setting, it's typically, we have a cookbook, it's called the Diagnostic and Statistic Manual, SIC, that gives us all of our DICE or DIRs, any type of disorder that we've been talking about, and in that cookbook there is a term that's called severe mental illness or chronic mental illness, which would be relatively equivalent.
Okay, and did Mr. Allen fall into that definition when he hit the doorstep of the DOC?
Yes.
And while he was at the DOC?
Yes.
Okay, you said, what did you call that? The D. I've known it as the DSMV.
Again, we like our abbreviations. It's the DSMV.
Okay,
That's the shorter version, yes.
all right. When were the other discussions? Well, I'm going to ask you about this. Did you have a chance to review Dr. Wallace's session reports or suicide monitoring reports?
Yes.
Can you just estimate for the jury how many of those you might have looked at?
Again, I'm not going to be terribly accurate, 'cause it would be a guess. I think she had maybe 30 notes, 30, 50 notes.
Okay, and in those reports, did you observe any kind of trend or recording trend from her that you thought was unique to Rick's situation?
I'm not sure I understand your question.
Fair enough. Was there anything about the way she recorded Rick's confessions and things of that nature that caught your attention?
Well, one of the things that is hard about medical records in general is that we're reading it through someone else's story, essentially, right? They're writing what they're viewing in their words. Medical records don't typically have quotes throughout the entire medical record. There might be a few words that are in quotes. And so when someone's relaying a story, and in this case with Dr. Walla, she's writing about his confessions, the confessions come across almost as if.
What impact on Mr. Allen's mental health do you believe this confinement circumstance, we've used the phrase solitary confinement, would have on him or did have on him?
And again, I'm not exactly sure, the totality of what you're asking, but in terms of what I was mentioning before, he's someone who, if you put him in a more stressful situation away from his family, those are two things that are kind of holding him together as having, before he was incarcerated, having organization in his day, knowing that he's gonna see his wife every day, being able to call his wife if he's having a bad day or he's worried, that he's letting people down. Being able to have her support him, you're pulling him completely out of that situation and putting him in an entirely new situation, I would liken it. This is gonna be a kind of an example, but we all know what confinement is like with COVID, and a lot of people didn't find.
We actually had a question about delirium. You just mentioned that. Tell the jury what that is and whether or not it's relevant to Rick Allen's situation.
Judge, I would object. The previous testimony was.
Well, that would be a weight issue. That was.
No, but that was the testimony, so that.
I'm sorry.
That was the testimony, so that would be sustained.
Yeah, that was the testimony, but if she has a different opinion, she's able to communicate that.
Judge, I don't believe any of her testing so far that she's testified to had to do with delirium.
Could I ask her a preliminary question?
Yeah, go ahead.
Is delirium a state of mental health in your industry?
Yes. We talked about the DSMV, it's in the DSMV as a mental health disorder.
Is there, tell the judge or the jury what, and the judge, what kind of things cause delirium?
Delirium can be caused by medical factors, so a lot of times you hear if somebody has a urinary tract infection or any kind of inflammation or infection, that directly relates to brain function and can change brain function. It can also be caused by medicines or substances, when people have been taking drugs, illicit drugs, or they withdraw from drugs, you can enter into a delirium, where you're confused and not oriented, not knowing what's going on, not knowing what's reality. And also again, in the DSM, it states that you can enter into a delirium if you have changes due to sensory deprivation, such as in.
Judge, I think that she's met a foundation to talk about the existence as it relates to Mr. Allen.
Overruled. Although there was testimony that it was medical and...
Yeah, okay. I acknowledge that. Thank you for that. So is the idea of delirium even relevant to Mr. Allen's circumstances?
I had a concern about delirium for a couple factors. One is delirium's known to be something that's present in solitary confinement. If someone's been in solitary confinement for a prolonged period of time with sensory deprivation, that they can enter into a state of delirium. The other things is that I saw for myself, and I know that he was drinking out of a toilet and he was eating his own feces and he had that nutritional deficit. He's not eating a lot. Those factors can all contribute to an inflammation within your body system, which directly relates to brain function and can get the same results of being disoriented and having difficulties distinguishing what's reality and what's not.
I'd pass the witness.
Thank you.
Ms. Diener.
Dr. Westcott, let's first talk about your reference to solitary confinement and sensory deprivation. Can you explain what you're referring to with regard to sensory deprivation?
Sensory deprivation would be any circumstance where you're limited in.
Okay, so you're saying he was deprived of interaction with people, correct?
Yes.
But Dr. Wallace saw him daily from December 5th through August, Monday through Friday, every day for up to an hour. Are you aware of that?
I never.
I'm going to object to that as not representative of the facts that are in evidence. She said that there was daily visits. It was referenced on the suicide monitoring report. In cross-examination, she acknowledged that many of those visits occurred because there was a mental health provider that would go to this door and talk to him. That was the evidence. So it mischaracterizes the evidence.
Judge, actually.
Go ahead.
Yes, actually, her records reflect that she met with.
Overruled.
Thank you.
So did you understand that Dr. Wallace was having daily sessions with Mr. Allen?
So I remember reading in her records that were times that she went to his cell and wasn't able to get him to respond, and so she didn't have a session with him.
Yes. Did you also see reports where she was getting him out every day, multiple days in a row?
I wouldn't say that so I'm confused, 'cause initially you're saying, my understanding of your question was that she was seeing him daily for an hour. That was not my understanding looking at the records, that she didn't have him pulled out of his cell every day for an hour, that there were times where she did have him pulled out of the cell. There were also times where she went by his cell, he was unresponsive, and she did not meet with him.
And so you indicated that you reviewed 30 to 50 notes of Drive Wallace's reports. Are we talking about the same behavioral observation report where it starts with his name, his date of birth, the date, the time, and then it has patient?
Yes.
And so you only saw 30 to 50 of those?
Again, that was an estimate. Unless I go back to there were an enormous amount of records in this case. I don't remember how many records, that was a guess.
I agree. If she met with him every day from December 5th to August, there would be hundreds, correct?
Well, again, what I would say is I see notes from her. Some of the times when she has notes, she's saying that he's unresponsive and she doesn't meet with him, so I wouldn't consider that a session that she was meeting with him.
Well, so who decided what notes you got? Did you get those from defense counsel?
I asked for all of the records from Westville.
And you believe that's 30 to 50 notes?
Again, without looking at my records, I'm talking about the notes that I can recall where there's content information versus if she's just stopping by, he's not responsive, and so there's not what I would consider a session.
Okay. You indicate that one of the things that would contribute to sensory deprivation would be being confined to a small space, correct?
Correct.
Okay. Do you have any information as to the fact that his window was replaced so he could see out of it, or to what extent it was scratched that he couldn't clearly see, or are you just basing it on what Mr. Allen told you?
I'm basing it on what was in the medical records. Mr. Allen did mention the window being scratched.
Okay. There was testimony that the light is on for his safety, but can be dimmed. Were you aware of that?
Yes.
Okay. Did you have an understanding of his availability to leave his cell for rec multiple days per week and also for showers?
Yes.
And did you have information regarding his ability to leave his cell to have his vitals taken on a daily basis by the nurse staff?
Yes. And in both of those circumstances, that didn't occur every day.
Was that also based on an array of a limited number of reports?
I'm not sure I understand your question.
I guess I'm questioning whether you got all of the records from DOC.
I wouldn't know, but I would believe so, because there were every single day that he was there in Westville. I've seen an abundance of records. It's not just from Dr. Walla, it's from Dr. Martin, it's from suicide watchers, and so.
And nursing staff as well?
Yes.
Please let the witness answer the questions.
And so what I'm mentioning is that when there were daily checks for vitals or if there were circumstances to allow him to go outside, he was either refusing or he was concerned for his life to leave his cell, that he might be harmed or hurt in some way.
Did you also receive information from his counsel with regard to their?
No.
And so in your report, you indicate that he made confession statements inconsistent with known facts. How would you know that?
That I'm looking at information within the medical records where there's, at one point in time, for example, he says that Satan killed the girls. So, I would make the assumption or have the opinion that Satan didn't kill the girls.
That's not a confession statement though, is it?
Correct.
Okay. Just to clarify, Mr. Rossi asked you a question about whether your testing revealed that he was not faking behaviors at the time that, back in time, prior to your testing, and I believe you responded that you said that you could determine that he was not lying on the test. Is that correct?
Again, I'm not sure that I understand your question.
If I would look at page 122 and over to page 123 of your report, under the section Exaggeration/Malingering.
Yes.
It says on the first full sentence on page 123, there's no evidence for deception or malingering throughout the cognitive examination. So that means you don't believe he's faking answers on the test, correct?
That's correct.
Okay. How were you introduced to Mr. Allen? Did the attorneys meet with him with you and then leave you to your testing, or how did that work?
No, they weren't there at all during that period of time. I was initially, there was someone who met me after I went through security, I'm not sure what.
Was it discussed with Mr. Allen that you were there on behalf of his counsel to assist?
I don't believe that I identified myself in that way. What I typically ask is if he was aware that I start with, are you aware that the appointment had been made and that I was going to be here today? It didn't seem like he had read that I was going to be there. And then I explained to him that I'm going to do an evaluation today and that, explained the limits of confidentiality in the evaluation and that it's part of the legal trial, and then I give him, it's his choice to be able to consent for the evaluation or to not consent to the evaluation, and that's typically what we go through.
So in that same section we were just talking about that ends on page 123, where you conclude, all evidence supports that his presentation and testing are an accurate and valid reflection of his current emotional and cognitive functioning. That's referencing at the time of testing, is it not?
That piece is referencing at the time of testing, yes.
Okay. I'd like to talk about high-S dependent personality disorder that you made reference to. That also appeared in Dr. Walla's reports, correct?
I believe that she either said he had dependent features or traits. I don't remember her diagnosing dependent personality disorder.
And so you related that to his attachment to his wife, is that correct?
Yes.
In the absence of his wife, is it possible that he attaches to someone else?
Not typically. Again, especially in a situation where someone has been with an individual for decades and also still has access by telephone, typically the pain and the hurt is consistent, and that was also consistent when I saw him in August in terms of his pain from being away from her. It's not typical that it just moves from person to person unless they become part of that inner circle, because, as I mentioned before, his typical fears are that most people don't like him, don't think that he's a worthwhile person, so he doesn't typically cling on or associate with other people in a strong way.
Okay. And so when he has a person that he clings to, like his wife, is that a person that and he has a dependent personality disorder, can you then conclude that that person is within his inner circle?
Yes.
He trusts that person. He would maybe talk to them about things he wouldn't talk to others about?
Yes.
Okay. And so if Dr. Walla documents throughout her time with him that he says things that, "You're like my wife," telling me what I want to hear, or "Please don't leave me, I need to talk to Dr. Walla. There's things I need to talk about, and there are only so many people I can trust." Are those the kinds of things that could lead a person to believe he has transferred his dependency potentially to Dr. Walla, since his wife is not available?
Not necessarily in this context. I mean, you have to keep in mind that she's one of the only people who was there and in helping profession and trying.
So what I hear you saying is that you disagree that he would find her to be a confidant of sorts and let her into his inner circle, despite the ways in which he may have referenced her.
No. I think we're having a different conversation. I said that I don't think that he transferred dependent personality disorder features onto Dr. Walla. That doesn't mean that he didn't confide in her and talk to her to a certain extent about his problems, but it's not my opinion that he transferred that person that becomes the dependent personality feature to Dr. Walla.
Okay, understood. Now, you do acknowledge in your report that people in a criminal setting may seek to avoid punishment by feigning symptoms of psychosis or insanity, correct?
That's correct.
And for lay people, feigning, exaggerating, malingering, it all comes down to faking. That's a layman's term, correct?
Correct.
Okay. And if the records that you were provided, isn't it correct that a lot of the videos didn't have a specific date stamp for you to be able to place them in a continuum?
Some of them did and some of them did not, yes.
Okay. Now, Mr. Allen is seeing Dr. Walla, a clinical psychologist, and then also seeing Dr. Martin, a psychiatrist, and you're aware of that, correct?
That's correct.
And they're having contact with him in real time with regard to these behaviors that are the focus of a psychosis diagnosis, correct?
That's correct.
And so, is there a certain amount of confidence you can have in them being there to observe daily functioning of Mr. Allen?
Well, I take their observations into account, there's no doubt about that. The other piece that, again, is extremely unusual and helpful to me is that I have an abundance of videos and other reports besides them of, these suicide watch reports are almost down to the minute at points in time of what they're noticing, so I'm seeing a lot of other information, in conjunction with what their reports are of when they're seeing him.
So in your evaluation, you were giving weight also to suicide companion notes in order to assess the circumstances, correct?
I wouldn't say assess the circumstances. They're talking about what his behaviors are. I would never say that there's somebody who can diagnose, and they don't diagnose in their notes, but...
Oh no.
The talking.
Yeah, I'm sorry, I must have not worded that correctly. When you're looking at all this information to determine what it may mean in your assessment, are you considering the suicide companion records in conjunction with the records of Dr. Walla and Dr. Martin?
I'm giving them a certain amount of weight, yes.
Okay. So I wanted to come back to that previous question that I asked about. Verbal confessions to the double homicide are inconsistent with facts. No. You aren't aware of the facts of the homicide investigation, is that correct?
I'm not aware of all the details of the facts, no.
Okay. Now, I think you've referred to, at least in your report, about psychosis being he was diagnosed with brief psychosis with related stressors. Are you related with that?
Well, I'll say that.
In the Walla report?
I will say that brief psychosis is actually a term from the DSM-4, so a previous version of the DSM. We mentioned before the DSM-V is actually the latest version that's been out for many years. That term, brief psychosis, isn't in the DSM-V. The indication and what I put in my report is major depressive disorder with psychosis. That's the classification system we use now.
Okay. And when did it change from 4 to V, do you know?
Oh, I want to say 2015, somewhere around 2015, 2016. It's been a while.
Okay. So we're still talking about a period of psychosis that is not present when he necessarily enters DOC, and it certainly is not necessarily as prevalent, say, after May or June, correct?
That's correct.
Okay. And so when a person is experiencing psychosis, aren't there factors that are part of psychosis and then other factors that are not part of psychosis? For example, is everything that he says during psychosis considered a product?
I'm not sure I really understand your question.
Yeah, it was a bad question. I apologize. So there's an onset of psychosis, correct?
Yes. Usually psychosis is actually more of a gradual onset, and then I don't want to guess entirely, so you tell me, but I think what you're asking, when somebody's in a psychotic state, whether it's a state, anybody who's in a psychotic state, they can be saying things that might be close to factual or not close to factual, or they could be completely a different reality. In general, I would say when someone is in a psychotic state, the majority of what they're experiencing in the world around them is not the same reality that you and I are sitting in.
But a person in psychosis can answer questions maybe about things that are factual and provide a reliable answer, can they not?
They can.
And so one of the things that was documented with regard to Mr. Allen was disorganized speech. Is that correct?
Yes.
And what does disorganized speech tell us with relationship to psychosis?
So disorganized speech is just one symptom that can be seen in psychosis. There are many other symptoms of psychosis, but it means that someone's not able to as well put together like multiple sentences at the same time that make sense, that follow kind of a logical order.
So did you actually have the confession statements documented by Dr. Walla on April 5th and May 3rd when you were reviewing all of these records and?
Yes.
And in your report, you summarized a lot of information that you considered. Is that fair to say?
Yes.
How did you decide what you would summarize and include in your report and what you would not summarize and include?
I'm trying to, as best I can, put in the key factors of symptoms or changes in symptoms, or if there are particular things that I find, unusual statements that wouldn't be an indicator of someone who is in a mentally healthy state.
And so when I read through your report, the detailed statement by Mr. Allen to Dr. Walla on April 5th of 2023 was not summarized. Is there a reason?
Well, I think you're talking about, and I'd have to go back through the dates to look, I think you're talking about what we were mentioning before, that it was something that is in Dr. Walla's writing. There weren't quotes around it saying that this is exactly what he was saying at that point in time. I do mention several other times when he has confession statements to Dr. Walla that were more quotes.
So the April 5th one was not included. Then I turn to May 3rd, and your entries from May 3rd appear on page 71, for your reference, and on this particular date, he makes another detailed statement about his participation in the crime, and yet you have 3 entries from May 3rd and none include those detailed statements. So did you not find them relevant to your assessment?
Judge, I'm going to object to the form of the question. Ms. Diener is inserting facts that are not part of the testimony today.
Judge, she testified.
It's facts, not an evidence.
That she reviewed lots and lots of medical records, had 30 to 50 notes of Drive Wallace that stand out to her, but that she had all of them available to her, and I'm just asking why that particular note of interest is not in her report.
Overruled.
Thank you.
So the question was, you have 3 entries from May 3rd, 2023, and none of them do you reference the very detailed statement by Mr. Allen to Dr. Walla. Is there a reason?
Well, when we talked before about what was my job in this evaluation, my job was to be able to discuss and evaluate what were the breadth and extent of symptoms while he was there during this period of time when he had confessions, and I'm looking specifically at mental health symptoms or changes in his behavior or thinking status, which if you look at those dates, I'm just back at that May 3rd. I'm actually describing some of the mental health symptoms that were existing there that helped me understand that he's still having a psychotic state.
But the fact that Dr. Walla indicated on that date that psychotic symptoms were not present you did not note.
So I would disagree with you. On May 3rd, it says that he's diagnosed with brief psychotic disorder, and that's characterized by disorganized speech, grossly disorganized and catatonic behavior. I mean, she's talking about.
There's actually an addendum on May 3rd to her May 2nd report, indicating that diagnosis to explain behaviors for the previous month. Do you recall that?
I don't have that in front of me.
Okay. And then on May 10th, and I promise, this is the last one I'll ask you about, page 72. Now, May 10th, if you may recall, is a session with Dr. Walla where he asked her to stay in the room while he called his wife, and you indicate in your note, Mr. Allen had a call with Mrs. Allen. Do you recall that?
Yes. I'm trying to find it on the page, because there were chunks that I grouped together. It's on page 72.
Yes, the very bottom entry in the
Oh, yes.
spreadsheet.
Thank you.
I'll give you a chance to take a look at that.
Yes, I see it.
Okay. So on that particular date, you note, he told her I did this and said, I think I'm losing my mind. Correct?
Yes.
Did you listen to the phone calls that Mr. Allen made to his wife that day?
I listened to the majority of the phone calls that he made to his wife. I don't remember particularly on that day.
Okay. I have no other questions, Judge.
Mr. Rossi. Mr. Rossi, I have no further questions. I'm sorry.
I have no further questions.
Okay. Thank you. Does anybody on the jury have any questions for the doctor? All right. Would counsel approach?
Sidebar conference conducted.
What is the difference between your diagnosis and insanity?
That's more illegal.
Well, but you didn't raise an insanity.
I don't think we can go there.
Defense. You never raised an insanity defense.
Yeah, I'd have to raise that.
You can't ask that.
Are breakdowns in mental function spontaneous and more violent than a slow decline in mental health over time?
Can you read that again? I'm sorry.
Are breakdowns in mental function spontaneous and more violent than a slow decline in mental health over time?
I'm not sure what to do with that one.
Yeah, I don't care.
I don't care.
If you don't want to ask it, I'm good with it.
Okay.
Yeah, it seems a little inaudible.
What is the difference between delusions and...
Oh,
That's fine.
that's a good one.
Do religious beliefs affect perception or acceptance of mental health issues?
Oh.
We didn't talk about religion.
Yeah, I think that's...
No.
I don't think we
No.
can tie those two together.
Wow.
It's the full moon.
Full moon? Something.
Can objective testing be interpreted multiple ways?
Yeah, that's fine with that.
Yeah,
Did your medical records prior to incarceration include any objective testing by the mental health providers who prescribed medications?
that's okay.
I don't know.
Are you able to diagnose dysgraphia, or does that?
That's not her.
Yeah, I don't see the relevance of that.
Pardon?
We're going to be talking about the common cold before this is over.
Is it your opinion that Mr. Allen's diagnosis is major depressive disorder with psychotic behaviors, or that he has a full diagnosis of a psychotic disorder?
I don't care. She talked about those.
Inaudible.
Yeah,
Is the MCMI considered a test that determines the control groups of his personality?
Oh dear. That's a no on that.
yeah, I don't.
They don't want anyone else to understand that, and I don't either.
Would the MCMI be an indicator of his honesty regarding some circumstances?
I think we can ask that either.
Okay.
We can't ask the witness that, so why would we ask if the test tells us that?
Okay.
It kind of goes to the ultimate issue.
Ultimate.
Yeah.
Question.
It's a good question. I'd be asking that question if I were them. That's what they're here for, right?
Does he understand right and wrong?
I'm okay with.
But the...
Well, wait a minute. I think that's the same as the last, right? We already asked. It'd tend to belabor.
Well, that's would the test be inaudible.
They're wondering about the test.
The test.
Yeah, I know, but it's kind of just the ultimate issue. I guess my contention is it's such a broad question.
So no.
I'd say that's a no.
Well, because, yeah, but then you get into the insanity defense where
Yeah,
they're going and,
makes sense.
yeah. In an early-on interview with Richard Allen and the police officer, Mr. Allen became confrontational and defensive, so this is the October 2022, the second one.
Okay,
Did you watch that video pertaining to your opinion that Mr. Allen avoids confrontations?
Very good question.
Yeah,
So do I just ask, did you review videotapes of his interviews?
yeah, I don't. I think the notes were inaudible.
Okay. Did you watch
I don't care.
the videos of his interviews?
If they didn't, then we can't really ask the second part of it.
Yeah,
Right.
Yeah,
Pertaining to that, yes. Did you watch the police interview videos? So if she says yes or no. Did she?
I think she's gonna say no.
if she did, then ask, because I don't know that they were on the list.
Did you watch the police interview videos? If someone has depression or anxiety as a child, would that cause them to commit crimes as an adult or become a sex addict?
Oh, goodness. It's a fair question based on our evidence.
I object to that.
Okay. If someone is a slow thinker, is it possible that they can commit crimes because they aren't thinking fast enough to be able to control their action?
Oh, she talked about
Yeah, his cognitive abilities during.
She said slow cognitive abilities.
Yeah, I think that's a wild inaudible. It just seems so general.
It seems as slow as you claim him to be.
Well, because she was talking about him being a slow thinker as a result of his incarceration. I don't think she
Not at the time he was.
She did not talk about his prior.
Right.
There was nothing about anything prior.
Yes, I agree.
That'd be a typical TV question.
Oh, that's great way to put it, a TV question, I like that.
A TV question.
Somebody's watching too much television.
Yeah,
You said that Mr. Allen had fears of leaving his room because of threats throughout the prison. If Mr. Allen has the common sense to be afraid for his safety, would he have common sense to fake his mental state?
That's not a bad question.
fair question.
Do you want me to put it in the context you said?
Sure.
Same context and
With your extensive background, do people with Mr. Allen's mental health history display physically violent behavior towards themselves or others?
I don't think it's relevant, because she's asking about other people.
well, she says him in his situation.
That's kind of character.
But yeah,
So no.
No.
And then we'll take a break after that.
Let me just say that that's a very nice suit.
thank you.
I like that.
My daughter picked it out. I said, I'm wearing the Jackie Onassis suit today. She said, I'm gonna want one.
The Jackie Onassis suit, this is awesome. I see we've. Polly Westcott got several no S, but
At least they're paying attention.
Yeah,
That's good. We've reached inaudible.
I'm really impressed with.
I'm barely paying attention.
The jury, yeah, very impressive.
All right, Jackie.
Okay.
Okay. Thank you.
now I've got that in my head.
Sidebar conference concluded.
All right. Sorry, doctor.
That's okay.
A lot of questions. Polly Westcott. Okay. You stated Mr. Allen had fears of leaving his room because of threats throughout the prison. If Mr. Allen has the common sense to be afraid for his safety, would he have common sense to fake his mental state?
That's a really good question. So the comment that I made about fearing to leaving his cell was actually made. Those comments were made before the point in time where I was saying the psychosis came on. So there were early symptoms I mentioned that I was concerned about in the records where he pulled back, had that slowed thinking, that was more towards December and March. Polly Westcott through March, and during that period of time was where he was making more clear statements of, he was reporting, other people were calling him baby killer, he was afraid 'cause people were threatening his life, those kinds of things. They weren't statements that were made during that period of time during psychosis time.
Any follow-up, Mr. Rossi?
No.
Ms. Diener?
No other questions.
If someone has depression or anxiety as a child, would that cause them to commit crimes as an adult?
That's a great question I feel I could give a whole lecture on. It really depends. I mean, everybody has. It's more about personality features than the presence of mental health issues. Plenty of people can commit murders that don't have mental health issues. People who commit murders also have mental health issues. If you're looking at just bare bones in terms of statistics and research, if you're looking at somebody who's more passive and they're more subdued and they're afraid of people, you're not usually looking at somebody who tends to be aggressive or hurtful. That's also consistent with things that I ask in my evaluation to try to understand the circumstance and how resilient they might be in a stressful situation.
Mr. Rossi.
No.
Ms. Diener. Polly Westcott. Polly Westcott.
So knowing if Mr. Allen is capable of engaging in aggressive or threatening behavior would be relevant, would it not?
Well, we're talking about in terms of his childhood behavior?
No, as an adult.
Well, I would say that those are questions that I ask. I would have to know. If you're talking about aggressive behavior, if it was during a psychotic episode would be different versus in his typical life when he was functioning fairly well.
So your experience with him caused you to describe him as passive?
I would say on his personality test, the objective personality tests, there were components that look at whether he's passive or aggressive, and he tends to be more passive, which is also consistent when I'm asking questions to him and also his wife about his history and how does he interact with people, what was his life like growing up. He tends to be less confrontational and more passive and submissive.
And so what if the aggressive or violent behavior is outside of a psychotic episode, but after incarceration?
Can you reword the question?
Yes. What if he's not in a psychotic state, but he's acting aggressively or threatening?
I would want more information. Like, for example, I know he was aggressive towards himself during periods of time both before incarceration and also after incarceration in terms of hurting himself. That would be a different type of aggression than acting towards someone else. Polly Westcott.
Okay, thank you. Polly Westcott.
Again, if someone has depression or anxiety as a child, would that cause them to become a sex addict as an adult?
I wouldn't say that I would necessarily equate those two things, no.
Mr. Rossi.
No, no questions.
Ms. Diener.
No question.
Mr. Allen was interviewed by the police in October of 2022. Did you watch the police interview on video?
I did not.
Any follow-up, Mr. Rossi?
No.
Ms. Diener.
No questions.
Is it your opinion that Mr. Allen's diagnosis is major depressive disorder with psychotic behaviors, or that he has a full diagnosis of a psychotic disorder?
So they're two very different things. He has a diagnosis of major depressive disorder with psychosis. That means that he had major depression, and when that major depression gets to a severe level with external stressors or stressors in his environment, then he ends up having this psychosis. A psychotic disorder is something you typically think of more in what's called schizophrenia, so they're having psychotic episodes and that's outside of the context of feeling. Polly Westcott really depressed, so they're having hallucinations and delusions and the depression doesn't necessarily need to be there.
Mr. Rossi.
No question.
Ms. Diener. Polly Westcott.
So would it be fair to say that someone who is psychotic has a lifelong diagnosis of a particular feature, whereas major depressive disorder with psychosis is a period in time?
Not necessarily, because what we know is that when people if they have a major depressive disorder and then they have a psychotic episode or psychosis as part of that major depressive disorder, they're actually 25% more likely to have psychotic episodes going forward, so it hits a threshold and then they're more likely to have subsequent psychotic episodes going forward. So it could be that once they have that psychotic episode, they could have continual psychotic episodes if they hit a period of extra stress later in life, too.
But again, it's an episode. It's not the other diagnosis you were referring to that was a person diagnosed as psychotic, correct? We're talking about an episode?
Well, again, in the DSM-V, it's called it's major depressive disorder with psychosis, and so it's not. There's not a start point and an end point in the DSM-V.
But is that person in a constant state of psychosis?
It can ebb and flow going forward depending on if you treat the Polly Westcott depression, that's usually what ends up improving symptoms of psychosis going forward, but even if you treat the depression and the psychotic symptoms decrease, they still have a potential of returning back at some point in time.
Okay, Polly Westcott.
Can objective testing be interpreted multiple ways?
I would say no. I mean, again, it kind of depends on what you're talking about. If you're talking about the personality test and the cognitive tests that we're using, there's a pattern that you see on cognitive tests and personality tests that are very well accepted in the field. In fact, we have kind of cookbooks that help us interpret personality tests. And not to get too technical, but there are codes that come up with each one of the personality tests, so if you're looking at the cookbook's kind of telling you exactly what those feeder ES mean. So there's not typically a lot of variation amongst psychologists who are looking at personality tests.
Mr. Rossi.
No questions.
Ms. Diener.
No question.
Did your medical records prior to incarceration include any objective testing by the mental health providers who would have prescribed medications?
I'm gonna say generally no. The only thing that you see is when there was a point in time when he actually was inpatient and they give, but it's more self-report, I would say, than objective. They're asking him questions about Polly Westcott's symptoms, they're having him rank his symptoms, and so you see really small scales. But I'll tell you, on those scales, they don't have factors like we were talking about. Is this truthful? Is this exaggeration? It's just a way that they kind of mark things as treatment goes by to know is treatment helping or are symptoms improving. So you'll see like a 1 through 10 kind of scale of depressive symptoms or anxiety symptoms, but I would not call those objective. They're typically seen as more subjective, even though there are numbers on the scales.
Mr. Rossi.
No questions.
Ms. Diener.
No question.
And what is the difference between delusions and delirium?
Another good question. Delusions are, again, it's a symptom. Delusions mean that someone has a false belief about something, and there can be lots of different types. It can mean that they feel like I come in and I say, I'm the President of the United States, and I'm telling you all about how I'm President of the United States, but you know I'm not the President of the United States, it's a false fact. It could mean that they have delusions like in this case, where you feel very, very guilty about something, and it could be guilty that's based on something that you know is not a fact. I mean, it's a false belief. Delirium is something that's very different. It really refers more towards someone who doesn't have an idea of where they are, who they are, time of day, they're confused, they have poor attention. I used a little bit of that funhouse analogy. They don't know top from bottom and can't really have the accurate perception about what's going on in the world around them. Polly Westcott.
Okay. Mr. Rossi.
No questions.
Ms. Diener.
Judge, may we have a sidebar?
Sure.
Sidebar conference conducted.
So she said, like in this case, when you have a false belief, and I've got the inaudible statement of the defendant with regard to the confessions, since that's inaudible. I don't want to make a big deal of it in front of a jury, but I would like to ask about if she is insinuating that the false belief is related to whether this confession is true or not, because she can't speak to that.
No, she can't. And we can't.
I know.
Put the toothpaste back in the
Yeah.
Tube.
I mean, it was her question.
Yeah.
I just think we just let it go. I think they're going to be less likely to.
It was not my question, it was.
Well, a juror's question.
A juror question.
Yeah, sorry. Polly Westcott.
I said, when you said false belief, inaudible.
Well, I mean it was.
It's a problem.
We shouldn't be trying to fix a question that she answered because she was asked it by the judge. I mean, you know.
And it's a juror question.
Yeah, I'm like, I think we're going to draw more attention to it than we already.
Okay, yeah.
And I appreciate that, but.
Sidebar conference concluded.
So, Ms. Diener, any questions?
No.
All right. Well, thank you, Doctor. You may step down.
Thank you.
Well, ladies and gentlemen, this is an appropriate time for us to take a quick break, give you an opportunity to get up and move around a little. While you're outside the courtroom, please keep your minds open. Please don't form any opinions or conclusions about anything. If you do discuss the evidence, please only do that if all 15 of you are present in the jury room at the same time, and please don't deliberate. Gentlemen.
All rise.
Jury out at 11:10 a.m.
All right, let's take 15 minutes. Jody, you can go off. Polly Westcott, the record.
Off record at 11:11 a.m. On record at 11:29 a.m.
All right. We are back on the record. Are we ready to proceed?
Yes, Judge.
Yes, Judge.
Can we get a sidebar real quick, please?
Yep.
Sidebar conference conducted.
I just want to kind of get an idea of where. Are we doing something with the videos again?
Yeah, I think we're gonna finish. We condensed 20 hours down to an hour and a half.
Oh, okay.
And I'm gonna click through that like I did the other day, so it's not an hour and a half.
Oh, okay.
That went faster.
Okay. Well, there are 6 members of the media clearly able to see your laptop, the screen of that.
I appreciate that. I had the screen down, like, because I was cognizant of that and I actually had it turned a little bit. I had the screen down. I was trying to not allow that to happen, but I didn't know. I heard about that 2 days ago. So I'm sorry I'm doing. Polly Westcott the best. I can't hardly see it, because I've got it that way, so I'm doing the best I can.
I guess I've got an objection, but I guess I don't if you're gonna play the videos. One was, I guess, 5 hours long that's been condensed. The other one was 2 hours long and, I don't know, are you gonna fast forward it or?
Yeah, so I said the other day, like for example, one of the videos is like 2 to 5 p.m., and when we took the screen grabs off and we put them like in double time so that you could play them quicker and it doesn't skip or anything. You know what I mean? How if you speed it up too much, it'll skip on you.
Affirmative response.
So we were trying to fight that battle, but we were able to accomplish that, and so I plan on handling this exactly the way I did the other day.
So these are showing.
So I'd have the same odds, I'm sorry.
And they're April and May?
They're April to May of 2023.
Inaudible.
Yeah, these are in cells.
And this is not in cell, so inaudible, 6 hours of stuff.
Yeah, we're not. Like I said, we've got it pared down. The total time is like an hour and a half, and I'm not even gonna. Polly Westcott show, I'm gonna ask you for permission to move this along, so I'm gonna narrow that way down. Yeah, that's why I'm trying to accommodate what your rule was the other day.
Will you show our same objection? I don't functionally know how. If you're putting it, you're fast-forwarding this, are you gonna have the jury back and to watch the whole thing at some point, or is this just basically, he's skipping along to the part that he wants to show? The jury's not seeing the whole thing. I'm not suggesting I want the jury to see the whole thing. I don't want them to watch 5 hours. But I don't know how that's gonna function with the jury not.
Well, he's asking to skip and Jody has to keep track of that. That's gonna be extraordinarily difficult to do, to see that where she is. And it maybe you're gonna delineate that request, because I can't monitor that, Jody can't monitor it, you may have to put that into the record, you know what I'm saying.
Yeah.
Controlled, yeah.
I don't know any other way on planet Earth to do this.
No.
I tease, with all due respect, this is their information that they were gathering and using, and I'm just trying to put it in this palatable form. If they have a problem with what I'm showing and they think it's misrepresenting it, then, I don't know.
Well, they could play the whole thing.
Yeah, they gave it to me. Polly Westcott.
The point that Jim brought up is I don't know which videos you're showing and what the content is, but if there's a part in there when he's interacting with someone else, like maybe washed in the shower, if you play it at fast speed, it makes it look like they're being rough with him when, in reality, they're not being rough with him, so.
Yeah, I don't think there's any of that. But it's like in double,
This is from Incel.
This is the incel stuff?
Yeah.
Okay, so he's just by himself?
It's all in cell.
It looks like it's inaudible. I don't know if I've got the right one, but yeah, Judge, I guess it's inaudible. I think it's all on them to calculate 10 minutes they believe.
Would be indicative.
All there is the same.
No.
Well, if that's what we get to.
Yeah.
I'd ask that for you stop it, and we have a sidebar.
I mean, he did spend 2 years in solitary confinement.
No, I understand that.
How else am I going to demonstrate?
No, I understand. Polly Westcott.
How cumulative his life was, you know what I mean, like.
Yeah. No, I get it.
I mean.
And that's why I gave you the ability to play the videos you really inaudible.
Yeah, these are definitely different circumstances.
Note our objection, Judge.
I will.
And I'm making a continuing objection. Thank you.
Sidebar conference concluded.
All right. So thank you for the sidebar. Again, the state's objection to what is going to be coming in is a cumulative objection. I overruled it on Saturday and allowed all of the movement video to be shown, but to the extent that this video starts becoming cumulative, I'll ask for a sidebar, and we'll have a further discussion on the state's objection. Are we ready to bring the jury back in?
Yes.
Judge, I guess scheduling, is the plan to play the video and then break for lunch and do cross after lunch? Is this gonna be the last time you're gonna use Mr. Baker for testimony? We didn't really talk about that, Judge, so.
I don't know if Mr. Baker's planning on. I think after the videos, yes, you would have the opportunity.
Okay.
To cross him. If they're putting him back up for other reasons, you can deal with it then.
Okay. Thank you.
Okay. You ready?
Yes.
Bring them in.
All rise.
Jury in at 11:38 a.m.
Thank you. You may be seated.
All right. Mr. Rossi, you may call your next witness.
We'd recall Max Baker, Your Honor.
Witness sworn.
What's your name?